Bowen from Startline Health and Wellness Group. Today we're going to talk about the hip joint. So often when you have hip pain, if you go to your doctor, you're going to be told that you have arthritis or that you're just getting older. One of the things I often will tell people is to tell your doctor that your non-sore hip is just as old as your sore hip. So what I find when I'm working with people with hip pain is a lot of times when we release the tight muscles or the muscle imbalances around the hip, that the pain actually subsides and the range of motion improves. So when we're looking at the hip, this is the pelvis here. The hip joint is a ball, fits into a socket. And there's a rim around this socket. It's a fibrocartilaginous rim. It's kind of very rubbery, hard rubbery. And that helps hold the ball into the socket. And we can see that there's a space here around that ball. And there's a lot of ligament structure helping hold this hip into place. So when you actually bend your hip up or down, we want to maintain this space at the hip joint to make sure that it doesn't get pinched. If you're bringing your hip up towards your knee and in, and that hip ball comes forwards in the socket, you often get a pinch in the groin area. So that can often tell us it's called anterior impingement. So what we have to do is often release the muscles around the hip to make sure that that ball stays centered in the socket. So the muscles we're looking at, if we come down to this chart, the hip joint's in around here. You've got your big gluteal muscles here that will pull on the hip. This running down here is the iliotibial band. When we look over here on this side, you've got these hip rotator muscles. And one of these is the piriformis muscle. And a lot of people hear of piriformis syndrome, and that can often make it ache right down the leg. The other muscles that are important for the hips, you can't really see them. They're the ones at the side here. And when this gets tight, it will make it ache right down the leg as well. Some people think it's sciatic pain, but it's actually coming from the hip muscles. When we look at the front of the hip, right in here, this muscle is the tensor fasciae lata, TFL for short, and it will often create pain at the front part of the hip, especially when you bring your hip up towards your knee, or your knee towards your shoulder. And the other muscles that are important are the quadricep muscles in through here, because they come up and actually have attachments to the front of your pelvis and will pull the pelvis forward and change what's happening at the hip. And then these big long muscles down in here are the adductor muscles, and they can get tight and pull on the pelvis and at the hip area and through there. So if you're having hip pain, come to Startline Health and Wellness Group, see one of the practitioners, and we can look at releasing the tight muscles, doing a check to see if the hip is stable and mobile. Because if you want to be doing anything where you're walking, if you have weakness in that outer hip area down here, when you stand on one leg, your hip often falls out. That tells us there's weakness in here. So we want to bring that hip back up. So we want stability, but we also want good mobility. So it's Wendy Bowen, Startline Health and Wellness Group, where we will take the time to treat you right.